The first one is related to the role of ovarian suppression induced by chemotherapy. It has been presented a trial from the Italian group, the GYM group, and what they showed is that ovarian suppression induced by chemotherapy does not affect the prognosis of patients with early breast cancer. We know from the past that other trials clearly showed that if you induce ovarian suppression, specifically in triple-negative breast cancer, you will have much more better prognosis with respect to patients in which ovarian suppression is not induced. So this is the first trial. Another trial that has been presented is the role of nipple-sparing mastectomy in patients with early breast cancer. They showed that nipple-sparing mastectomy is not associated with a higher risk of relapse. In the trial, we have a lot of limitations. We don't have the expression of CRB2 for almost 50% of the patients, and we know very well from literature that if you have HER2-positive breast cancers, you have higher risk of local relapse following nipple-sparing mastectomy. And we missed some information about type of treatment that patients received. But the final message of the presentation was that nipple-sparing mastectomy is a safe procedure with a very low risk of local recurrence and a very low rate of complications. Finally, I would like to mention the presentation of male breast cancer. You know, male breast accounts for 1% of all breast cancer patients. We don't know nothing about this type of tumor. A treatment of patients with male breast cancer is extrapolated from females, so we treat them like female, but we don't know if it is the same thing. And the presentation from this young scientist from the Netherlands Cancer Center was quite interesting because she presented data on almost 1,200 cases of male breast. What is very clear is that male breast is an endocrine responsive tumor. We have a very low expression of CRB2 in male breast cancer patients. And the prognosis is not so good. Despite median age of the patients was around 69 years old, so maybe there are concurrent disease that may affect survival. So the final message is that we need trials also for male breast, or we need maybe to include patients with male breast in the trials for females.